Thanks for the team at Viz. Once again, my name is Neil Haranhalli. I'm a dual-trained endovascular, cerebrovascular surgeon at Montefiore Medical Center in the Bronx. We've been using and have implemented Viz at our institution over the last 3 years, really, with amazing results and amazing impact on our patients and their outcomes and our workflow. And I'm really excited to talk a little bit about what's coming up beyond stroke, beyond ischemic stroke, with Viz and our collaborations with them. So, many of you may already have Viz at your institutions, at your hospitals, and if not, one of the best parts about it is the proven AI platform. The platform that allows, from the beginning, that allowed ischemic stroke LVOs to be identified, triaged properly, and a streamlined communication platform to be able to communicate with other providers as well as other members of the team was really key. And what's great now is that this whole platform is being brought to aneurysm and eventually to subdurals as well. And so that's what we're going to be talking about today, about the new and upcoming aspect and platform with Viz for aneurysm. So going straight into it, Viz Aneurysm is the new automatic AI-powered platform that's going to allow us as practitioners and providers to better assess, evaluate, and identify patients with incidental aneurysms that come through our system and get them into treatment, or at least get into evaluation faster and more effectively. So I think the first most important part is understanding what the problem is, right? Ischemic stroke, it's an easy problem, right? Identify the LVO, get them fast, time is brain, we know that. But there is still a problem when it comes to incidental aneurysms, and the fact of the matter is that we always want to catch aneurysms and find people with aneurysms before they come to us as a subarachnoid hemorrhage or as a rupture. And so identifying incidental aneurysms as quickly as possible and getting them in to see practitioners that treat aneurysms or watch or observe or evaluate them is really key. And so these incidental findings are often getting missed in the current process flows that most institutions and most hospitals have. Additionally, there's an inconsistent care pathway, right? Patient comes into the emergency room for either a non-specific headache or abdominal pain or a minor accident, a motor vehicle accident, gets imaging done, cerebral imaging done, vascular imaging done. That's oftentimes become standard nowadays in most institutions. And an incidental aneurysm is found, but it's not, even though it's red, the patient's left the hospital, the patient is not called or given follow-up to see a neurosurgeon, interventionalist, neurologist, or anyone who follows on aneurysms, and that patient gets lost to follow-up. And this becomes a real big problem, both for patient care as well as the referral base, right? Patients who then go out to see their primary care physicians, they don't know how to get them back to see people like us who take care of patients with aneurysms. So how can Viz help? Viz is really going to help by streamlining that whole process and reducing the time and improving our ability to identify aneurysms and reach out to patients quickly. So it really is bringing the care team to the patient and to the patient before they leave the hospital, which I think is a really, really key point, because once the patient leaves the doors of the hospital, the ability to track and ability to bring them back into care becomes immensely more difficult. So here's a quick demo. It's a few videos that we'll take you through. And basically what this is going to show you is that Viz has been able to implement the same wonderful user interface that we've had for LVO and for stroke to aneurysm. And so just to get started real quickly, these all videos are going to be playing side by side, but I want you to focus really on the central video. So within your app on your mobile device, you'll be able to see a list of all the cases that your institution, that your ED are sending through for their images. And you'll get a notification on this page if an aneurysm has been detected. When you open it up, you still have the same wonderful PACS viewer that Viz has developed, where you're actually able to scrub through the images, the scout images, look at MIPS, move the image in 3 dimensionals, and really come up with almost a treatment plan if you needed to, right? And I think a key part, which is we're going to talk about, is that Viz right now has in the market has the best rating for the smallest size aneurysms detection. And so the algorithm is really going to be key in identifying aneurysms that either are going to be missed or that may be considered by a primary care or ED doc that they don't need to be seen by someone. But we're going to be able to see these now and make that judgment, ourselves. And then once you actually are able to kind of go through the image itself, a really key part, and I think this has actually really been amazing, and it can be individualized for the institution, is what's called the aneurysm clinic. The aneurysm clinic is a way to streamline your communication with either your NPs, your office staff, your radiologists, people who are going to be part of your care team to get these patients in, to be able to see them at a timely manner so that they don't get lost to follow-up. And I think this aspect, being able to have this customized for each institution and work with your workflow, with the multidisciplinary team that you have, and how you're going to interface it is really key. And it allows each institution to be able to make those changes based off of what works for them. You can send communication, you can send notes, you can send the images to providers so that they're able to kind of make a plan for the patient and prepare. And this interface is really what is great and what we have seen to be a huge benefit with Viz as we've worked with it with ischemic stroke over the years. This communication platform built in to an imaging platform is, I think, where Viz really takes the lead. So now for some data, because we all need and love data, right? Biggest point with these algorithms is how well do they work, right? And so while the internal data portrays up to a 93% sensitivity for these imaging, it's important to have external validation. Dr. Khan's team at UTMB did an independent study where they validated the algorithm looking at consecutive CTAs and comparing them to the Viz algorithm. And what they found was that even externally and independently validated, the sensitivity and specificity for identifying aneurysms that are 4 millimeters or higher, so pretty much any aneurysm that we're going to treat electively even, was above 90%, 91, 94%, matching pretty much the internal validation metrics that Viz had. And I think this is really key, right? Because as the world of AI develops, the biggest question is going to be how well do these algorithms work? And I think this is proof in the pudding that the algorithm works well, and there's going to be more research built on top of this. But this sets the stage that this algorithm is something that can identify aneurysms, and we already know that the Viz platform allows for a streamlined process flow to get these patients in. Additionally, I think one of the biggest questions for those that are practicing is, well, how is this going to affect my actual practice? How are these patients going to get to me? Is this going to affect my ability to evaluate and assess and manage these patients? In an investigator-led study that was done, that's still in the process, some preliminary data suggests that there could be a potential of over 130% increase in referral rates because of two things really: timeliness to identifying the aneurysm and getting the patient in, and a streamlined communication with providers to be able to get that flow of the patient from the ED before they leave the ED, set up with appointments and so forth. And this process flow is going to integrate really well with each institution, with each hospital, and can potentially do two things. Once again, really aim at improved patient care, because that is the goal, right? Get into these patients before they rupture, before they have a growth of the aneurysm, before they get into trouble. And number two, getting these patients not to have loss of follow-up and to actually be found, right? So a leakage from any system is something that we worry about, and this is really going to help in alleviating that problem. And I've been mentioning it, I think, a lot so far, but I think a real key metric are these numbers, right? It's very standard right now. Right now, even prior to the Viz implementation in our institution, patient would come into the ED, incidental aneurysm, only if by chance the ED physician or team read the radiology report, except for no acute findings. If they read the report fully, would they call either neurosurgery or call a provider or try to schedule a visit with a primary care? that takes time, and most of the time the patient's not in the hospital anymore. The patient has left the hospital, and in populations such as ours, where many patients have a low education level or a poor socioeconomic, the access, the ability for them to get back into the system is very difficult. So addressing this before they leave the hospital is really key, and breaking this time down by 40 minutes, almost an hour sometimes, is, I think, the value of that is unsurmountable. The last portion of this is really just to talk about, once again, the algorithm. I think we've taken a look at how the VIS algorithm works when looking at different aneurysms, and as you can see here, it works extremely well regardless of where the aneurysm is. And I think the key portion really is, the maximum aneurysm diameter. As small as 4 millimeters, sensitivity of VIS to identify these aneurysms and pick them out is still as good as 93%. And I think that as a screening tool is immensely important. But to move a little bit further, is even looking further in the future, is subdural hematomas and VIS subdural. So while aneurysms, we're really trying to get them ahead of the game, obviously subdurals, these patients are coming in and oftentimes either have asymptomatic or symptomatic subdurals, but are not getting caught right away. VIS subdural is going to allow added capability for those of us that treat subdurals, whether endovascularly, as we saw in Monday's session, or surgically, to be able to identify these patients early, quickly, and start to make clinical decisions about how to treat them, whether we think they need to go to the operating room or if they need to go under embolization, or they can be observed or whatnot. And it allows a much more streamlined process to that evaluation, given the AI protocol of being able to identify the size, the shift, and the other aspects to it. Further data, once again, showing that the algorithm with VIS for subdural is surpassing those of its competitors, all above 90% in its ability to identify all types of subdurals, acute, chronic, acute on chronic. And I think this aspect is really going to be beneficial. We've already started implementing this using VIS Recruit, which I'll talk about very shortly. But these are all aspects that VIS is building into it. And to help further their algorithm with subdurals, building in hyperdensity to look at whether it's acute, chronic, as well as the presence of shift, midline shift, are aspects that are getting built into this, and hopefully very soon are going to be available for everyone to take part in. And VIS Recruit, as I had mentioned, this is an aspect that we've already been using at our institution, at least for a year or so now. This is an aspect and a platform of VIS that's going to allow you to really improve your ability to screen and enroll patients for clinical trials that you may be in. Here we've got membranes as an example for subdural. At our institution, we've been a trial member for Enrich for minimally invasive clot evacuation, ICH evacuation, and have been using VIS Recruit for that. And so this aspect of VIS Recruit is really going to expand your abilities to screen and enroll patients for subdurals, and even to an extent for any of the other products that VIS has, in terms of your ability to see patients, get information on them, that get objective data to be able to make those decisions if this patient is someone that you can enroll, if it's someone that is going to benefit from treatment, and move forward from there. So I tried to keep it concise as possible, given the time constraint, but we're really excited to have VIS Aneurysm come on board. I think this is going to really benefit our patients and work well for our institutions, and hopefully if you guys have any questions, I'm around, as well as the technical team, for any other questions. So thank you.